So we're here at Jindalee in Canberra, where we've got students working with nurses and clinical facilitators to have a positive experience working with older people on site.
So the CPOP program is clinical placement with older people.
I'm Gina Casey, I'm one of the residents here. Traditionally we've had a shortage of nurses. Engaging them so that they stay fresh and in the industry as opposed to just being left on their own, I think is a really important part of this process.
Well, the CPOP program widened my experience because I've had an aged care experience in the hospital setting. So being in a residence setting really does give me a refreshing experience.
Before, I used to get a lot of students saying, I want to start my career working in the hospital, but they have changed their concept now. Maybe they have been, more open to the care that we have been providing to our residents.
Aged care is relevant to all nurses and all nursing students, and I think it's really valid for everyone to have a good understanding of what it is to be in the field of geriatric nursing, to develop an understanding of the complexity of care and also the depth of knowledge that nurses who are in the aged care, residential or ward care require.
In the hospital, we get allocated different patients every day, but as opposed to residents, they're always here. So every day you come to work, you see the same patients, so you build the same amount of rapport over time as opposed to hospital settings.
It's also about complex care like catheters, epileptic seizures, some stomas, and we provide a palliative care to the residents who have entered towards the terminal phase. So yeah, they're really getting this experience in this journey. With the wound care, we take the student nurse along with the registered nurse because they have to be supervised at all the time. We just don't leave the students on their own.
A lot of them walk away after the program with a whole new appreciation of what it is to be an aged care nurse and working within the field, and they build really lovely therapeutic relationships with not only the nurses but the residents.
People as they get older have been themselves for longer, and so their choices and preferences and ways of living needs to be supported as they might develop complex and chronic illnesses. And nurses have got the skill sets and the knowledge about those different kind of complex comorbidities, dementia, delirium, cancers, different kinds of care needs. That's what our nursing students need to be learning and be ready to provide as we go forward into the brave new world.